Hi, my name is Audrey Mahoney, and I will be doing a presentation on the fatigue and depression in elderly patients with poorly controlled diabetes, written by Irfan Isen, Selena Turk Isen, and Hakan Demirci. Type 2 diabetes is a major global health disease. Just does not affect just elderly patients, but many people across the globe. The prevalence is higher in elderly patients due to the decreased activity and increasing obesity rates of the population. Obesity is very prevalent due to the fact that they're not able to walk around, exercise as much as they used to, whether it's due to age, their proneness to injury, or more. The monitoring of type 2 diabetes in elderly patients is important due to the risk of long-term complications. Their bodies are already at risk due to their age, and when you add an extra illness on top of it, it can cause a lot of issues, and the constant monitoring and constant care is very important. Depression and fatigue has already been shown to be 3 times more common in elderly patients due to this, and this can cause high emotional distress and high healthcare costs. The aim of the study was to measure the severity of depression and fatigue with poor diabetes control and evaluate it comprehensively. So not only just looking at it from a physiological point of view of how their body's reacting, how their pancreas is, but also looking at the psychological effects. The methods of this study were as follows. It was a sample of 310 patients with age 60 and over. They were not only diagnosed with type 2 diabetes, but they had an HbA1c level over 10%, which is their blood sugar level. 2 scales were used to measure the depression and fatigue severity in these patients. One was the geriatric depression scale. It was from 0 to 30. And depending on the score, the higher the score, the higher the severity of depression was. The lower the score, the less severe, the less likely you had it. The fatigue severity scale was a Likert scale. It was anything more than 4 was high fatigue, and anything less than 4 was low chance of fatigue, or low severity of fatigue. Other factors, not only age, but type 2 diabetes, were taken into account, such as the patients could not have any acute diseases, their age, so whether it was 60, 65, 90, like elderly, or their sex, if they were male or female. The duration of their diabetes, the comorbidity, and the body mass index. But not only were physical factors included, their marital and educational status were included. This study was done over a 6-month period from December 2018 to June 2019 at the Bursa Yüksek İhtiyaç Training and Research Hospital. Varying duration of diabetes were recorded. 160 patients of the 310 had diabetes aged less than 10 years. 100 patients had diabetes aged from 10 to 20 years, and 50 patients had more than 20 years aged diabetes. The geriatric depression scale scores were measured as yes, 1 point was given, and if you answered no, 0 points were given. The total score was their depression score. The GDS score was weighed as 0 to 10 as no depression, 11 to 13 as possible depression, and over 14 was indicated as definite depression. The fatigue severity scale was a Likert scale. 9 items were included related to fatigue. Anything over 4 indicates severe fatigue. Anything less than 4 didn't indicate severe fatigue. The results of both scales are shown here as follows. The GDS score greater or equal to 14 made up 52.9% of the patients. The GDS score less than 10 was 33.5%, and the GDS score of 11 and 13, 13.5%. So 13.5% of patients had moderate GDS score less than 10, which was likely no, was 33.5%, and definite depression was 52.9%. The FFS score, 78.7, had severe depression, and then the FFS score of 21.3, which was not severe depression, was measured. Results analysis were as follows. More notable information is women scored higher in both the geriatric depression scale and the fatigue symptom scale. This can be due to many factors, due to Could this be whether the male and the female body and how they react, or could this be societal, or could there could be many interpretations to this. Even the method of intake of insulin was shown to change the GDS and FSS scales. If you use pre-mixed insulin rather than the oral antibiotic insulin, it was shown to have an effect. The elderly patients that had diabetes aged over 21 years scored higher on both scales when compared to patients that had diabetes aged just under 10. Now, this could be many factors. This could be living with the disease and it taking over you and your body, just not being able to handle it, or due to how fast healthcare is evolving now. People who got the diagnosis earlier are able to combat it quicker, while people who have had it for a while have not been able to combat it like they should, like they could have. People who lived alone scored higher on both scales. There was a lack of relationship between BMI, smoking, age, and the high density lipoprotein and triglyceride levels had no really relationship between the GDS and FFS scores. Women were way more affected than their male counterparts. Behind type 2 diabetes in the depression and fatigue area. They were more likely to experience fatigue 1.5 times more than their male counterparts, and they were more susceptible to somatic symptoms such as pain. There could be a correlation of fatigue and vitamin D levels of 20 milliliters. So if you had 20 milliliters and above, you scored lower on the GDS and FSS scales, but if you had deficiency, which is 20 milliliters and lower than 20 milliliters, you had a higher score. Some limits of the study was only conducted in one hospital and not enough for the diverse population was shown. It was only one location, not assisted living facilities, not other areas. Elderly patients who lived alone with partners or family had lower depression and fatigue rates rather than ones that lived alone. To me, that showed that when you have somebody taking care of you, you have somebody helping you through this disease, it helps your depression and it helps your fatigue levels, which could be a method of treatment in the future. It could be a possible choice. When you're diagnosed with this in their age, you could be admitted to a hospital or you could move in with your family. In conclusion, the hypothesis of the original study that the type 2 diabetes causes depression in elderly patients was proven correct, especially when your blood sugar glucose levels was over 10%, especially in women, especially with long diabetes. The most effective parameters for the FSS score was the GDS score, diabetes age, hemoglobin, and vitamin D levels. The most effective parameters of the GS score were the FSG and the FSS scores. The psychological aspect should always be evaluated along with this physiological aspect. It needs to be a part of their career as a whole. However, it needs to be mentioned that when you talk about vitamin D levels, the study did not fully take in consideration iron and B12, so there can really be there can be a correlation seen, but it also cannot be seen as a whole. And for the treatment plans, this should really be taken seriously. It should not just be only looked at in a physiological standpoint, but needs to be looked at a psychological standpoint. Their needs should be met, their insulin intake should be met, their dietary needs should be met, and they should be following the proper restrictions and care. But they should also be able to have the psychological effects of seeing people, being around people helping them. And maybe that would affect in the long run.